Hello, my name is Cheryl Erickson and I'm the Indigenous focused ECE instructor with Louis Riel Vocational College. Today we will be talking about Chapter 13 in Nutrition, Health and Safety for Young Children. Please ensure that you are reading Chapter 13 as this video is not a replacement for your daily readings. So today in Chapter 13 we're going to discuss enhanced safety in childcare centers and how we can enhance that safety of children through appropriate environments. And so when we talk about safety, we talk about the impact of safety on healthy environments. And so we want to ensure that the environment that we're providing for the children that are coming into our care is physically safe. And we want to ensure that nothing within that environment is going to intentionally harm or hurt a child. So we want to protect them from as many injuries as possible. We want to select safe and age-appropriate toys and equipment for them. We want to support their emotional safety by protecting them from anything that might make them fearful or give them any anxiety. And we also want to make sure that our environment is conducive of meeting those basic needs. So safety, security, those types of things, creating a classroom that is going to promote the emotional well-being of children. So what does an unintentional injury mean? It is predictable and preventable events that could harm a child. And so some of the typical predictable and preventable injuries in a child care center range from bumps and bruises and scrapes. It does go on to say disability or death. Those are not common and are not rare occurrences in childcare centers at all. We really work hard to make sure that we're providing a safe environment. So it does say that there is an estimated nearly 9 million children under the age of 19 are seen in hospitals and emergency rooms yearly. I just want to say that that is an American statistic, but I can, having 4 children of my own, I did frequent many of the emergency room for stitches and you know, cuts and bruises and the odd broken bone for children that get very active in their play. And we also have to keep in mind that children's bones develop a little bit differently than adult bones, and they are softer. So fractures can occur a little bit more often in a fall as well. So some of the hospital visits are because of falls, an object banging against them. So getting, you know, for example, getting hit by a toy hockey stick could cut a lip, or bites or stings. So bug bites are a common occurrence in the summertime, of course. What is the role of some of the regulatory agencies? And when I say that, in Manitoba, we have Manitoba Early Learning and Childcare that licenses centers, and we follow those best practice guidelines. Or regulations is another term for them. So they create the standards for childcare settings to follow, and those standards are put in place to protect the children from harm, to keep them safe, and also those standards of practice help children learn and grow and develop. How do we determine which programs to be licensed and what some of those factors are? Here in Manitoba, you can operate unlicensed facilities. There's people that care for other children in their home. You know, you have to be mindful that even within that, there's rules. Licensing your facility, you would contact licensing and they would come and see you, and it would all be based on the size of the environment that you're looking at. And the size, the space of that environment is going to determine group size, the length of service, and the location as well of care. So you're not going to be licensed to care for children if you have no green space. So part of being licensed is that you need to have green space within a certain number of feet, because children need to have access to outdoor play and a safe playground to play in. So that would be something that would not happen if you could not offer that green space. Some common licensing requirements, and I'm going to go through this list. These are not Manitoba Early Learning and Child Care's requirements of their list. So if there's something that's not similar, I'll speak to that. And if I'm going through the list and I think of something else, I'll add to it. So first off, licensing application fee. There is not a fee associated to license a childcare center here in Manitoba. There is a set standards and a checklist that a coordinator would use in determining if your program meets licensing requirements. So they would go through that checklist, and everything would have to be in place in order for you to receive your license and for you to open. Qualifications is an issue here in Manitoba. In order to receive a license to operate a center, you have to follow a requirement that states 2/3 of your staff have to be trained ECE 2s or 3s. So that if you don't have that requirement within your center, you will not receive a license to operate. Children's health and nutrition is a process that you do have to follow. So you will have to have menus, set snacks, a daily routine that outlines when your meals are going to take place. You're going to have specific policies to medication administration and administering medication, to storage of medication, health and safety practices. So all that would have to take place before your license would be received. You're going to have a daily schedule, what your daily program looks like in terms of indoor free play, outdoor play, nap time. It's all going to be set and structured, and that document needs to be posted in your center as well as viewed by your coordinator for licensing. Manitoba Early Learning and Childcare does investigate complaints. They will come out to the center and speak to the director, observe the program if a complaint does arise. And they will do that because they want to ensure that, again, the program is safe for the children to attend. And that kind of goes hand in hand with violations. Violations are a safety issue, and if a violation occurs, there's going to be consequences to that center. That violation is going to be posted online at the Manitoba Early Learning and Childcare, and it will be posted in the center for every parent to see, so that those parents are aware that, today on today's date and what happened that was the violation. So those are really important practice to follow. Just to go a little bit more, Manitoba Early Learning and Childcare website does have icon on it where you can view license violations. So you can go on there if you want to investigate this a little bit further to see what types of centers in Manitoba have had violations posted and what they were about. And I can tell you that those violations are never taken down. They stay with you to the end of till your center closes for whatever reasons. So as early childhood educators, we do have responsibilities. There's responsibilities within our program that we have to adhere to, and those are best practices, that are put into place to make sure that children are safe. And so our facility has to be safe. Here in Manitoba, we have a locked facility policy. Manitoba Early Learning and Childcare offered grants to centers to help them ensure that they had some type of locked door policy. So we were given money to put on key fob scanners, video systems, so that visitor access could be monitored. So they subsidized us essentially so that we could put those practices in place to keep children safe. We will have developed policies and procedures for safety. So safety enhancement plans, we practice our monthly fire drills. We best prepare our staff and children in the event of an emergency. Not only do staff have to know what's happening, but children have to know what's happening so that they are going to be safe as well in those. We have safe hiring processes here in Manitoba. So when we do hire staff, we do reference checks, as well as all our staff have to have criminal record checks, child abuse registry checks, first aid, and CPR before hiring as well. We will monitor compliances with safety rules, so we will be throughout the year monitored not only by Manitoba Early Learning and Childcare, but we will see the fire department come in to monitor us, and workplace health and safety, as well as Manitoba Health will come in and ensure that we are following proper protocols for fire, that we have no fire hazards within our building. Things that could cause fire, as well as that we have some healthy food preparation, storing of food practices. Those are really important practices, and not only should you practice fire, but you should practice lockdowns as well. I can tell you off the top of my head, I recalled 3 times this year in Winnipeg school divisions where there was lockdowns because of issues happening within the neighborhoods. And it's important that children practice that and know what to do in those types of situations as well. It keeps them safe if they're informed. We as individual ECEs need to take some responsibility in care for our children, so we want to make that personal commitment to safety. Regulations state, yes, you need to practice your monthly fire drills. You have to do that. That's my professional responsibility. I need to make sure that every month I am doing that and I am documenting that, because I want to keep everybody I work with safe. Implementing those safety practices as well. Simple things from when your snack tray comes out and there's a knife on it to cut up your fruit. What happens if you have to get up and move away from the table to that knife? What's your process to ensure that a child doesn't happen to take that knife and start to cut the apple themselves and maybe cut their finger? We want to model safe behaviors. When we're going for walks with children, we want to ensure that we have safety protocols, that the adult stays in front, that the adult isn't always looking ahead. The adult needs to make sure the group is with them on that walk, that we don't cross the street without that whole group being at the light before we move. All those are really, really important. And we need to discuss those practices with our families as well, so they know what we're doing and the importance of doing that as well. Or they may have suggestions to offer us to best to improve on what we're doing. So challenges that could be faced in creating those safe and appropriate environments. It could be, the varieties of space that you're utilizing, range of services needed, and sometimes we can control with what's in our space, but we can't control what's in the space outside the center. However, you can put some protocol into place of what you're going to do if you're going to visit a neighborhood park. And maybe that means that prior to the children arriving at the park, that somebody goes and scans the area to make sure that it is safe. And so things like broken glass, that you're not finding any needles and things like that in the environment before your children go to play there. You don't want those types of things to be found by children, because that puts them at risk for harm. You can't control it if you're borrowing or renting the space as well. So if your daycare is you're renting the space during the day, but it's a bingo hall or something else in the evening, your environment can be altered by what's taking place in the evening. So again, you should have some protocol of what happens in the morning when you reset as a daycare. You should allow for your staff to get in there well before the children get in there, to ensure that everything is put back in its place and it's safe. Money is an issue. Often daycare centers struggle because they are not for profit, and everything costs a lot of money. So you need to best utilize your budget in order to make sure that things that are required are prepared, and adjust your budget accordingly to ensure that children aren't playing with damaged, broken types of equipment that could harm them. And again, as ECEs, we do have a responsibility in looking at what's in our environment to ensure that it is the message of things that are needed to be repaired is being passed on to the appropriate source, so they can seek out somebody to do that, or is it things we can repair ourselves, and taking one step further and making that repair. But at the end of the day, children shouldn't play on or with things that could cause them harm. How do we design appropriate spaces for children? First and foremost, looking at appropriate space, having something that is child size, is for children is really important. Demonstrating how to use things is really important for young children. Looking at your environment and visualizing the potential that it could be and what should go into that is really important. If you have 2-year-olds, what you might put in your room for furnishings is going to be different for 5-year-olds. So things that are going to be smaller and bigger have safety factors on them as well as children use them. And also looking at developmentally appropriate for the children is really important as well. Building codes and facility requirements have a lot of considerations to that. And again, that's all a part of are you owning your own building? Are you renting it? As far as the licensing process, because there's certain building code requirements before you are going to be licensed as well, and what's appropriate for children. So I can tell you off the top of my head that I know that, safety-wise for children, you can't operate in an environment that doesn't have electricity if it's in the middle of December and it's 30 below. That is putting children at risk of safety. And you can't operate in an environment if on today, like weather like today, where it's a high humidex and it's 29 outside, it's really hot, and we don't have access to drinking water. That could put the children at harm because they could get sick, heat stroke, sunstroke, and not being able to rehydrate themselves. So you need to have basics. You need to have water, sewer, electrical, heating, cooling, garbage services, a communication system. You couldn't operate your facility if you didn't have a phone. Because keep in mind, you're caring for children that could have health issues, healthcare plans, what happens if it's an emergency, how do you contact emergency responders if you have no means of communication. So issues like that would prevent you from caring for children because you cannot adequately keep those children safe or your staff safe, for that matter. And as far as actual building codes, In order for you to be licensed, you're going to have to go through a fire safety check, meet fire regulations, which would ensure that you have proper marked safety exits, that you have smoke detectors, that you have a fire alarm system, sprinklers. All of those requirements are needed, especially some in caring for certain age groups. So infants have higher, caring for infants, there's greater regulations for that to be licensed. So things like that are very important protocols when you're caring for children. I did say earlier that managing security is a huge issue. We don't want just anybody walking into the environment where we're caring for children. We need to protect them, and so we have instilled in all programs in Manitoba. It is the law that they have to have safe access. And so a lot of centers have key fobs for parents that allows them to directly enter, or a way for somebody who is coming to visit or is inquiring about the center, intercom system or a doorbell where we can access and communicate safely from inside to the individual outside before deciding it's okay or not to let them in. So we want to control that access and not just let somebody in and realize it's a problem and then have them in our environment and try to seek emergency help. We can seek emergency help with them standing outside the door and knowing that everybody within that environment is safe. Organizing a safe classroom environment, so knowing where our exits are, how we safely enter, where we should go to when we arrive, where we should exit, safe pathways through the room. So how do I get from the bathroom back to the lunch table safely? There shouldn't be things on the floor that might we trip over. There shouldn't be baseboards sticking out of the wall or empty ceiling tiles, wires hanging out. All that could be could put children at risk for harm. And especially if you're a child that might have some limited motor ability too. We want to really make sure that there's nothing obstructing their way, wheelchairs, things like that that could make it tippy, or walkers. We want to ensure that it's safe for children to move around. Taking advantage of windows, it's really nice, not only the natural light and to be able to see outside, but you know, it's that opportunity to see what's happening in your neighborhood and then reacting to it as well, or finding out what's happening through it as well. Your furniture should be child size, appropriate for the different ages, locating it safely throughout the room so that children can access it. It shouldn't be in the way, it shouldn't be a barrier. You should have a way of moving around your room that's safe and easy to use. How do we choose what belongs in the classroom? Again, we're going to make those choices based on the age of the children that we're caring for. So, for example, if I am choosing furniture and equipment for an infant room, I'm going to choose some softer textures. I'm going to have limited high shelves, tippy things. I'm going to have softer toys, like softer blocks. I'm not going to have big wood blocks that could be picked up and dropped on their toe. I want them to be able to easily crawl and move around and explore the room without a lot of furniture in that. So that would be a consideration. I want to pick tables that are appropriate height for the children. So my infant and toddler tables are going to be lower to the ground than my school age or preschool tables. So essentially, I am meeting the needs of each group, and we're going to evaluate our furniture on a regular basis to make sure it's safe, so that there's no nails or screws, or our wooden shelves don't have slivers sticking out of them. We want to make sure that we're removing any unsafe things that could scratch or potentially harm a child. We want to safely store all our materials and supplies. Everything should have a spot, a place labeled that we know what's inside of it. We want to make sure lids are on securely, so if we're taking things off a shelf that are high, that the lid isn't falling on us or things are tipping out on us as well. Clear, transparent bins are great for storing supplies because you can see what's inside them. Medication, if we're storing that, it should be in a locked box. So the locked box is not easily accessible by children. You might have medication that needs to be stored in the fridge. You need to store a locked box in your fridge as well as in your cupboard. Not something that children, again, can easily access. All your cleaning supplies should be stored out of reach of children, so in a high-up cupboard, and it is recommended that it's locked as well. So that's one step further. Children cannot gain access to that. And in the event of an infestation of bugs or rodents, you're going to have traps that kill it or trap it so you can release it, opposed to poisons and things that rodent could potentially pick up and remove and move around to the places where children play. That's not safe. And actually in Manitoba, if you have mice or any type of infestation, you need to hire a company that's going to work with you to remove that infestation. So that is a regulation. And they want to monitor that because they want to ensure that you are proactively getting rid of whatever it is that's infested your environment. As far as controlling hazards, we do have safety practices again put into place, creating safe wall displays. Here in Manitoba on our bulletin boards, you can only tack or staple one piece of paper onto that cork board. You can't put paper on top of paper. That is a fire hazard. We can't have things hanging from the ceiling that could potentially catch fire and then fall onto staff or children. That is a hazard. You need to have outlet covers put in your outlets all the time, because if a child puts something into an outlet, they could be electrocuted. That is a hazard and is a protocol in order to be licensed. And again, we do have to do our safety checks and our monthly fire checks. It is also not recommended in Manitoba to have those little pop-up tent structures that you often see for kids. The little tents or teepees that you see that kids can play in. They're not recommended actually because they burn quite quickly and could be very harmful to a child in the event that there was a fire. That plastic would just immediately become inflamed and stick to your body, right? So not a good safe toy. Safe indoor environments for active play. What should they look like? A safe indoor environment, if you have children running around and kicking balls or riding bikes, should have a lot of space. If you're going to put toys and equipment like that and you're going to allow children to run, you want to give them enough space so that they can safely do it, not run into each other. If you have running and bikes going on at the same time, you're going to want to define your space so children know that running is over here and bike riding is over here, so you don't have any potential accidents there. As well as different ages. So when we're talking about safe outdoor environments, it's not really recommended that your infants be crawling around where your preschool and school-age children are running. You can see that would not be a safe environment for the infants. So your infant space is going to be separate from your preschool and school-age space. You want your spaces easy to manage as far as supervision, so you should have a direct line direct vision to the children around you. So there shouldn't be obstacles in the middle of it that potentially affect your ability to supervise the children. And as staff are out supervising children, they should be spread around your park so that everybody is monitoring and supervising an area and can help children in those particular areas if need be. You should also have a space for all your equipment to go to when it's not being used. Safely stored, locked away, prevents theft, as well as access to drinking water. So children are very active, they get thirsty, they could get dehydrated very easily. You should always take drinking water wherever you go and remind children that they need to have a drink of water. Selecting safe toys, we look at, again, age-appropriate toys. We want infants to play with toys that are safe for them, soft, smaller. We're looking at more things that they can easily pick up and manipulate. Infants like to put a lot of things in their mouth, so things that are safe for them to go into their mouth. Enough toys. One of the documents that we looked at in this course is the minimum requirements listing of what each curriculum area should have in it. And so that listing tells you specifically how many toys, and not in all cases, in most cases, how many toys you should have per child. Or if there's 8 children, how many toys you should have. So that kind of sets the tone of thinking about, yeah, I can't have only one toy for 8 kids. Is that okay? Is that setting everybody up for success? 8 kids all wanting to play with one toy, that's not fair. So you need to have considerations like that. You want toys for active play, toys for passive play, and toys that teach wellness concepts. And so, wellness concepts could be what you add in your daily living center to your manipulatives that teach you how to button or zip or tie. So those are just a few examples. Our safe environment outside is a huge area that we really need to spend a lot of time thinking about. Often our safe outdoor environment can be accessed by others in the hours that the daycare isn't open. I highly recommend that you have a lock on your gate so that not everybody can get in. However, sometimes fences can be climbed, and so you need to think about what happens prior to that first group going out in the morning, and somebody needs to do a safety check to ensure that that space is safe, that there's nothing in there that could potentially harm a child. It should meet the needs of your group size. So if you're licensed for 40 children, your outdoor play space is going to be sufficient enough for 40 children to freely move around and have fun while they're out there. It should be fenced. So again, that's keeping your children safe from harm is why we do fenced. It allows them or keeps them in an area off the street or off a parking lot. They can't just run away if they see something that sparks their attention. So it keeps them safe in close proximity to the adults as well. It should be accessible to the children too. So it should be a park should be easy for them to get into and out of. And when you're considering children that might have disabilities or delays, think about that as far as being accessible to, say, a child in a wheelchair. So that does conclude Chapter 13, Enhancing Safety Through Appropriate Environments, in our Nutrition, Health, and Safety textbook. Please see your instructor if you have any questions regarding Chapter 13. Also check in to ensure that you haven't missed any assignments or handouts pertaining to this chapter.